checking for my safety. Good morning, Emma.
Good morning.
I am a nurse. I came here to talk about your new medication. Is that okay if I come in?
Yeah, it's okay.
First, I'm just gonna wash my hands, okay?
Okay.
So I'm gonna apply water and soap in my hands, and I'm gonna wash palm to palm, back to hand, fingers interlace, fingers interlock, rotation of thumb, tips of the fingers, wrist. Gonna rinse, dry, and close with my elbow. So Emma, before I proceed, can you tell me your full name?
My name is Emma Hargreaves.
Okay, and your date of birth?
020262.
Okay, and can you tell me your address?
Number 2 Long Street, Northampton.
Okay, so I'm happy that I have the right patient. So Emma, do you have asthma?
Yeah.
Yes?
Yeah.
So I came here to teach you and to give you the salbutamol, okay?
Okay.
Do you have, are you allergic to anything?
Nothing.
You have no food allergy, no medication, any dressing?
No.
Are you feeling comfortable now?
Yes, I'm comfortable.
Okay, so we're gonna talk about your medication. You have prescribed the salbutamol, which you're gonna take is an inhalated drug. You're gonna inhale this drug. It helps to relax your lungs and help you to breathe in and out. Because of the asthma, you might feel that sometimes it's hard to breathe. So every time that happens, you're gonna use the salbutamol, okay?
Okay.
Salbutamol is sometimes make your heart speed a little bit, and you might feel a little bit of headache, but after a few minutes, we expect that the symptoms gonna disappear. Is that okay?
Okay.
You can use up to 4 times per day, and if you have more than 3 crises per week, we advise you to schedule an appointment with your GP and maybe change your medication, maybe increase the medication, okay?
Yes.
So it's okay if I just prepare my medication and come back?
It's okay.
So I'm gonna prepare my hand hygiene. I'm gonna take my disposable trail. I'm gonna take the salbutamol. And I'm gonna take a new box of a spacer, which is here. The box is intact, dry, it's in date. And I'm gonna check my prescription. I have here Emma Hargreaves, 2nd Long Street. Date of birth 2/2/62. I have the right patient. She has no allergy. And I have here prescribed for her salbutamol, which is this drug that I can see, which is intact. It's in date. And the dose is 200 milligrams. And I can see here that I have 100 milligrams for each time that I press the canister. So for this medication, I'm gonna give to her 2 puffs of the salbutamol. The route is inhaled, so it's the right patient, it's the right medication. I can check the correct dose, the correct route, and the prescription is signed by the Dr. A. Jones, Blip 123. It has his signature. Is due for today. So I'm happy that I have all the checks. I'm gonna come back to Emma. Hi Emma, I'm back.
Hi.
I'm gonna explain how to use this medication because I understand that's the first time that you're using, right?
Yeah, that's true.
So you're gonna use the salbutamol with a spacer. It's a container, a plastic container that will help you to better absorb the medication, okay? So at home, when you feel that it's hard to breathe and you're going to a crisis, you're gonna take your box of the spacer. You're gonna open. You can see this one is clean, it's new, and you're gonna connect like this. You're gonna connect one part to another. This part is the mouthpiece, and this other part is where you connect your medication, okay? So I have here the salbutamol. Can you check with me that I have the salbutamol?
Yeah, that's salbutamol.
And it's prescribed for you 200 milligrams, but every time that you press the canister, it's released 100 milligrams. So you're gonna do this twice to receive the medication, okay? So before I give this medication for you, can I have a last check? Can you tell me your full name?
My name is Emma Hargreaves.
Okay, date of birth.
020262.
Okay, so your prescription is signed for Dr. A. John, split 1, 2, 3, okay?
Mm-hmm.
So what you're gonna do at home, you connect the spacer, you're gonna take your medication and you're gonna shake for 2 seconds, and you're gonna connect here, okay? So you're gonna stay in sitting up straight as possible. You're gonna exhale. You're gonna totally seal your lips around the mouthpiece, and you're gonna give 1 puff. After the puff, you're gonna breathe in through your mouth during 2 or 3 seconds, slow. Try to hold up to 10 seconds if you were able to, and then exhalate normally. And then you're gonna wait 30 seconds to the second dose. Is that okay?
That's okay.
Do you have any doubt?
No.
If you have another medication that's inhalated, you need to wait 5 minutes, okay?
Okay.
And if this medication is a steroid, you need to wash your mouth after the medication, okay?
Okay.
So let's go through this again. You're gonna connect your spacer, mix your medication. We already checked this, the salbutamol. Connect here in this part. Seal your lips, exhale. Seal your lips around the mouthpiece. Press on the canister and breathe in. So I'm gonna ask you to demonstrate for me, okay? So my patient is sitting straight up. She's holding. You need to hold the spacer horizontally, okay? Don't flex cannot flex your neck up and down. Need to be in a neutral position. You exhale. Seal your lips. Press. Breathe in. Hold 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Breathe out. And after 30 seconds, you're gonna do it again. Assessor, can I assume the 30 seconds have passed?
Mm-hmm.
Emma, are you ready for the second round?
Yes.
Yeah, so let's do it again. So breathe out. Seal your lips around the mouthpiece. Press the medication. Breathe in. 1, 2. Hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then breathe out. So after finish, you're gonna remove your medication, put it back to the box. You're gonna clean your spacer with alcohol wipes, let it air dry, and then put it in the box again, okay? You can use it for 1 year, and after 1 year, you tell your GP and you're gonna change your spacer, okay? Sometimes if the patient has a good absorption of the medication, they stop to use the spacer and go straight away to the pump, okay?
Okay.
So I'm checking your medication. I'm gonna put in your notes, Emma. Demonstrate the use of the medication properly. Okay. So I'm gonna perform my hand hygiene. So Emma, if you need anything, please just let me know, okay?
Okay.
So I finished my station.